N- So clearly, there's, like you said, there is some kind of dependency problem where, at least in many African countries, not all, right, but in many African countries, a significant majority of the healthcare spending expenditure is from external donors. And why is this a problem?
Yeah, so I think there are quite a number of issues and don't get me wrong, right? External funding is not bad. So
Hmm.
it's not inherently bad. So I don't want to give that impression at all. In many contexts, and I guess in all the contexts where there is a significant dependency on external funding, is because there is clearly a need
Hmm.
in those contexts, right? And so external funding is helping to meet that need. I think the issue is how that external funding is deployed. And it
Okay.
creates a number of issues. One of which, is, for example, is fragmentation and verticalization. So you have, the global funds for AIDS, TB, etc. You have Gavi and the likes. And so when you have those kinds of funds, what they do is they create vertical programs to address very specific gaps or needs
Hmm.
in the health sector, in the health system, in a particular context. So, for example, all the funding that goes into HIV, what we've seen is that it tends to create these vertical HIV programs that are very well funded, that achieve their goals, and so on the surface, those kinds of approaches and those programs are doing really well, and oftentimes they are needed because the health systems in a lot of African countries have challenges, and so there was a legitimate need to create
Hmm.
those vertical programs to be able to tackle these serious problems, health problems at the time. But now, what happens is that there is no incentive for these programs to be integrated into the healthcare system. So there was a study in Kenya that looked at this, and it found that a lot of the people, the health workers working in these vertical programs, they
Hmm.
did not want to give up. I'll say the comfortable life that that they had sort of come to become used to
Hmm.
as a result of these well-funded integrated programs. They didn't want to lose control of resources. They didn't want to lose control of influence. And so there is no real incentive for them to integrate into the rest of the healthcare system. And so the rest of the healthcare system suffers. And we can't treat people as diseases. We have to treat people as people. So if someone comes with HIV, he might have a mental health problem. He might have a non-communicable disease problem. But if you only have funding to address his HIV or her HIV, or their HIV, then you neglect the other problems that could be harmful to them as well. And that fragmentation also creates transaction costs, which we don't talk about because health officials, policymakers, they're dealing with so many different donors, and so they're not spending enough time on orienting their own health system to
Hmm.
work in the way that it should, because there's this transactional cost with jumping from one meeting to the other, from one program to the other, as a result of this fragmentation and verticalization. It has also been said that some of the the external funding could displace funding that should go towards healthcare. And I saw this statistics that says for every $1 of health aid that is spent, domestic health expenditures are reduced by about 0.4 cents to even more, to one cent, $1 and 14 cents. And in fact, this external funding to the health sector might actually be subsidizing other sectors, because the funds that should have gone, the domestic funding that should have gone into the health sector, now gets to be diverted into other sectors. And that might not be a bad thing in the grand scheme of things. But then if you have a health system that continues to be weak, then one questions, the logic of having this external funding displacing domestic funding. Then there are
Mm.
issues like lack of country ownership. There are challenges with prioritization for policymakers because every donor comes with their own agenda, with their own priorities. Who do you listen to? Which direction do you go to? Do you have the power to set your own agenda? When there are powerful donors that are putting billions of dollars into your sector, so it complicates things. And then
Mm.
in some cases, there's even an issue with lack of transition with lack of transition planning. So some countries over time graduate from being, let's say, low income to middle income country. And when that happens,
Mhm.
you lose access to some of these external funding. And it happens so abruptly that if you're not prepared, if you had not planned for it, there
Mm.
can be devastating consequences. For example, when Romania transitioned to becoming a middle income country, Global Fund stopped providing around $20 million in HIV funding.
Mm.
And that led to a spike in the prevalence of HIV among injecting drug users from 1%, around 1% in 2000, to 53%
Wow.
in 2013. So you can see that there are very real challenges.
Mm.
For all the benefits that I have to acknowledge that external funding has brought and continues to bring, there are challenges as well.